In the first section of our lecture, we will discuss the primary liver tumors. And the primary liver tumors which we will talk about in this section will be the fibrolamellar hepatocellular carcinoma, epithelioid hemangioendothelioma, and also the gallbladder cancer. So the primary liver tumors are the fibrolamellar hepatocellular carcinoma. HCC is hepatocellular carcinoma and is fibrolamellar hepatocellular carcinoma. It is a rarer variant in young adults, so it's not a very common tumor, rare. The alpha fetoprotein negative, and there is elevated neurotensin. So alpha fetoprotein levels, it's not elevated, it's negative in this fibrolamellar hepatocellular carcinoma, and there is elevated level of neurotensin. There are normal LFTs, liver function test, and there is no cirrhosis. We discussed in detail when we talked about hepatocellular carcinoma that the liver cirrhosis is caused by the chronic hepatitis C virus infections can lead to the cirrhosis of the liver, and the cirrhosis of the liver can progress to hepatocellular carcinoma. But in this primary tumor of the liver, which is the fibrolamellar type of hepatocellular carcinoma, the important feature is there is no underlying cirrhosis, and also normal LFTs, liver function tests are also normal, so the liver is not damaged as that badly to affect the liver function test, and they are normal. And then we have in this, there are multifocal huge masses, and there is slow growth of this tumor. So multifocal, different foci are present, not unifocal or bifocal, but different focus of the tumors are present. There are huge masses, and then its growth is slow, and it is not associated with underlying cirrhosis. Liver function tests are normal. So these are some very diagnostic features of the fibrolamellar type of hepatocellular carcinoma. Some presentations associated with the fibrolamellar type of hepatocellular carcinoma, the patient will have a weight loss. Here you can see it's a huge mass, big masses of the carcinoma that is being removed. So weight loss is common with the hepatocellular fibrolamellar type. There is fever associated with it, and I already mentioned it's multifocal. Different foci in the liver are present of the fibrolamellar type of hepatocellular carcinoma. Then the treatment for this is surgical resection. Here the surgical removal is being performed. So surgical resection is important treatment option for fibrolamellar type. Then there is a series of liver transplantations and anecdotal responses to gemcitabine plus cisplatin. It's not a research-based response to these drugs, but it's the general information received by the use of these drugs on different patients with fibrolamellar hepatocellular carcinoma, and they found beneficial for this type of the hepatocellular carcinoma. So anecdotal response to gemcitabine plus cisplatin. So these are the drugs which are effective against the treatment of fibrolamellar hepatocellular carcinoma. The next type of primary liver tumor is the epithelioid hemangioendothelioma. So again, the primary liver tumors are the tumors which are originating from the liver, and then if you notice, they are in the fibrolamellar type also. The underlying cirrhosis was not present, which is very common in the other type of hepatocellular carcinoma, and also the liver function tests were normal. So in this epithelioid hemangioendothelioma, this is the vascular, it's again the rare form of the primary liver tumor. It's the vascular tumor of the adult. So as the name shows, hemangio is for the blood vessels, and endothelium is the inner lining of the blood vessels. So this is the tumor that is developing from the endothelial lining of the blood vessels. So it's the vascular type of the tumor. Usually again, like the lamellar type, fibrolamellar type of tumor, this is also multifocal. There are multiple focuses are present, foci of tumor are present, and as I mentioned, it's endothelial in origin. It arises from the endothelial lining of the blood vessels. The endo is the innermost lining of the blood vessels, so endothelium. Then this tumor has, or this primary liver tumor has prolonged survival, so the prognosis is good. It's not poor prognosis, and as whenever there is good prognosis, prolonged survival of the patient with the tumor or cancer, it means the cells are not poorly differentiated, they are well differentiated, so the prognosis is good and they have prolonged and good survival rate. There is no underlying cirrhosis in this condition or in this tumor, also epithelioid hemangioendothelioma, no underlying cirrhosis of the liver. And also this is all OLTX employed also. This is the microscopic histological picture of epithelioid hemangioendothelioma, again developed from the endothelial lining of the blood vessels, and that's the gross appearance of the tumor. Then the gallbladder cancer. Gallbladder is a small structure in the present below the liver, and this is the storage site of the bile, which is the greenish fluid that is stored in the liver, in the gallbladder, and it's very bitter taste when the patients who vomit when they have empty stomach, that greenish biles come out and they taste very bitter taste in the mouth. So this bile is very effective for the metabolism of the fatty foods. So people who have cholecystectomy performed or gallbladder removed, usually they have problem in absorption and metabolism of fatty food. They feel very heavy and full stomach because after eating the fatty food. The reason is the digestion is not being performed properly. And here you can see this is the picture of the gallbladder cancer here, and this is the gallbladder. The gallbladder cancer has very poor prognosis, worse prognosis. In those with, usually it develops, gallstones are very common. A lot of people who come and they complain of pain in the upper right quadrant or right hypochondrium. When the ultrasounds are performed, they have gallbladders present. So gallstones are common in the gallbladder, and these cancers usually develop in the patients who have a history of presence of the gallstones. There is non-specific serum markers like carcinoembryonic antigen and CA19-9. They are non-specific serum markers present in the gallbladder cancer. CT scans or MRCP, which is magnetic resonance cholangiopancreatography. Cholangio is the term, we will keep using it later on in the lecture, but cholangio is for the biliary tree bile ducts. So cholangio is the term used for the bile ducts, and pancreatography is the recording of the bile ducts and the biliary tree and the pancreas. And CT scan or MRCP is used for the diagnosis of the gallbladder cancer. Chronic cholecystitis, pain, weight loss. These are some findings associated with the gallbladder cancer. Very poor prognosis, worse prognosis, survival rate of 5 years with the gallbladder cancer is very, very low, and usually the patients who have gallstones present and the gallbladder cancer, they have, especially with the gallstones, if the gallstones are present, usually the patient comes again and again with cholecystitis. They have a history of chronic cholecystitis and inflammation of the gallbladder, and this is the site when they come and they complain of pain in the right hypochondrium or right upper quadrant of the abdomen. And there is also weight loss is very common because the eating is not right, the fatty foods are not absorbed and metabolized properly, so weight loss is also common. So these are the some again patients who have stones, history of stones, gallstones, they develop gallbladder cancer, and usually with the gallbladder stones the patient have a history of chronic cholecystitis. Cholecystitis is the inflammation of the gallbladder, and they have pain and the weight loss, and that's the appearance of the gallbladder and the gallbladder cancer. So all these are the primary tumors. We discussed about the fibrolamellar cancer, and then we talked about the gallbladder cancer, and then these are all the primary tumors that develop from the liver primarily, and they are not metabolized or metastasized from other parts of the body to the liver. The treatment of gallbladder cancer is simple or radical cholecystectomy, complete removal of the gallbladder, and then the radiotherapy, adjuvant radiotherapy is performed for the cancer, and then again with the treatment also the prognosis. Keep in mind the prognosis is very poor with the gallbladder cancer. This was all about the section 1, which was about the primary tumors of the liver. Thank you for watching sqadia.com.